I think Victoria, she's here today as well. And Marianne, you should have the ability to unmute yourself. And I was looking for Alicia.
Alicia?
Is Alicia, is she on? I didn't just want to double.
She's here.
Oh,
Hi,
perfect. And then Laura.
Hi, thanks so much, Darlene. Good afternoon, everyone. Thanks for having us. We have a packed presentation, but we'll try to be quick so that you can ask your questions for your nutrition and physical activity branch questions. My name is Marianne Hernandez, and I work for the Active Transportation Safety Program within the Center for Healthy Communities, just like the NEPAB branch. My colleague, Victoria Custodia, Alicia Ramos, and I support Caltrans statewide safe walking and biking education and encouragement programs called California Active Transportation Program. And we had a poll, but we're gonna skip that. And we're going to go ahead and if we could move Alicia to the objective slide, if you can advance them. Yeah. So we have 4 objectives.
I'd just say, Alicia, you should have the ability to share your screen.
Okay, because I see that there's something up now. But yeah, let me share.
Perfect. There you go.
There we go.
Thanks, Alicia. So if we'll go to the objective slide. Yeah. And just quickly, we're going to tell you about the ATP, who can apply, how you can partner with the Active Transportation Program, and finally, you'll hear from Lara Turnbull from the City of Long Beach and her evolution in working with the Active Transportation Program. So I'll turn it over to Alicia so she can tell you all about our programs. And again, thanks so much for having us.
Great, thank you. And I do have my eye on the time, so I'll make sure to finish up on time to allow for you guys to end your meeting. But with that said, so what is the ATP? I want to start first by highlighting that the ATP is a transportation funding opportunity. So it's not your typical public health grant that we are all accustomed to. So the terminology and the application itself may not be what we're accustomed to in public health. However, there is room and benefit for public health in the ATP. So the ATP is dedicated funding for walking, biking, trails, and safe routes to school projects. The ATP is preparing for its next cycle of funding, which is cycle 7, and the funding is estimated at approximately $550 million for fiscal years 2025 through 2029. Those funds are divided into 3 parts, with 50% of the funds being allocated to the statewide competition. Another part is allocated to regional funds, and then there's some money for small urban and rural projects. The previous cycle, cycle 6 funding for local awards for infrastructure, non-infrastructure, and combination projects ranged from 60 million to over from 60,000 to over 5 million. CalFresh projects happen on even number years. So currently the ATP is preparing for its cycle 7 CalFresh projects on March 21st, and it will close on June 17th. And then I've added a link at the bottom to the ATP website where you can visit to learn more about ATP. You can also access past workshop recordings. You can view the guidelines and just learn much more about ATP. And I know that you guys share minutes and notes after each of these meetings, so you guys will have access to those links as well in your notes. So who can apply to the ATP? Local, regional, and state agencies. So for example, this includes city, county, and regional transportation planning agencies. Transit agencies, these are agencies responsible for public transportation, public schools or school districts, federally recognized tribal governments, and private nonprofit organizations may apply for recreational trail projects only. And what type of ATP projects are accepted? So ATP funds a variety of different projects, and one of those is plans. So this is the development of a community-wide bike, walk, safe routes to school, or active transportation plan in a disadvantaged community. It also funds non-infrastructure activities. So this is where public health really comes in. Here we focus on education, encouragement, and evaluation programs of active transportation projects. It funds infrastructure projects. We're looking at new or improved bikeways, walkways, safe routes to school, bike parking, so anything infrastructure related. Combination projects, this encompass both infrastructure and non-infrastructure projects. So if a project has components of both the non-infrastructure and also infrastructure, you would be applying for a combination project at that point. And then there's quick build, and this is a type of active transportation project that puts bicyclists and pedestrians or traffic safety improvements quickly. And we use semi-permanent, durable, and low to moderate cost material. The purpose of a quick build is to immediately address a safety need with the ability to test the improvement while receiving feedback from the community before a project is made more permanent. And these typically last 1 to 5 years. And so a few pictures here just to demonstrate some funded ATP non-infrastructure activities. And at the top, we see a bike train. These are students participating in a group bike ride, either to or from school, with an adult guiding them. At the bottom left, there's the walking tours, walking school bus. And then on the right corner, we see the promotion of walk to school days that schools can get involved with and promote for their students and staff. Then I also want to put a special plug in for demonstration projects. Demonstration projects is a non-infrastructure activity, and demonstration projects are a temporary display of a proposed street improvement. It allows for the community to experience and learn about the proposed design. Demonstration projects really brings both the non-infrastructure and infrastructure projects through community engagement, and we highly encourage local health departments to look into these and to learn a little bit more about demonstration projects and how a community can really benefit by the experiential learning and through the experiential learning of a temporary display of a demonstration project. And there is a great webinar on demonstration projects that took place just this past January, and I've added the link there for anybody interested in viewing the recording to learn more about this type of project. But then there are also some pictures here showcasing a demonstration project. You can see that the four-way stop intersection was temporarily transformed to a roundabout using non-permanent material that can easily be removed, but also still allowing the community to experience the potential street improvement. And then one more slide with a few more pictures. You can see here the before and after picture of a demonstration project, again, using that low-cost material that can easily be removed and still allowing a community to experience the proposed change. And these demonstration projects usually last a day to a week long. So we want to recognize that there are multiple roles for local health departments to get involved with ATP, and the role that you would like to take on is largely a function of how your local health department operates and the capacity that you have. We know that at the local health department level, you guys wear a lot of hats, but ATP is just one more way you guys can get involved. And so the first off, local health departments can pursue and be the applicant and seek funding for non-infrastructure projects. In this role, the local health department would be the responsible agency that manages the all aspects of the project. Secondly, local health departments can be highly involved in this work as a formal partner. Some sort of you can have a collaboration. So here you're attending advisory meetings, you're encouraging local agencies to pursue an ATP, you're still hands-on, but not necessarily functioning as that first role of the lead applicant. And then finally, local health departments can serve as a resource for a local application. So health departments have access to a lot of local health data, and so that can really be highlighted in an application and really help strengthen the application. And this is just mentioned here. We've listed just a few names of local health departments who have led or have partnered, have been a key partner in a ATP project. And so we're always encouraging for more involvement, but these are some of the local agencies that that we have engaged with before in the past. And this here is just to demonstrate that similarly to how CalFresh Healthy Living is broken up into regions, Caltrans also functions in a similar way and has designated personnel in its 12 different districts statewide. And with that, I will pass it to Lara, who will speak to us about her involvement in ATP and in her community of Long Beach.
And Laura, you should have the ability to unmute yourself up in the top ribbon.
There we go. I was clicking the button, but nothing was happening.
Okay.
And my apologies if my camera suddenly goes off. We have some very strong winds here today, and I think it's playing games with with some of my connections. So if I start to go into matrix mode, I'm just going to turn off the camera because the audio seems to be fine. So thank you for inviting me to share with all of you a little bit about our journey. I was asked to share about our journey into the world of ATP, a little bit about how and why we considered applying for this funding, a few bumps in the road we encountered that maybe me sharing with you might make your journey a little smoother. I'm going to share a little bit about the types of activities that we're leading and how our ATP funding really complements what we're able to do with CalFresh funding, and share a few tips based on our experience for anyone considering whether ATP is right for them. If you want to go ahead and advance, there we go. So we first, I actually, in preparation for this, had to go back through some notes. We first explored the possibility of ATP funding in 2015. It was what was Cycle 2 funding. And we looked into it because we were in the process of developing our Communities of Excellence Pedestrian Master Plan. This was a plan that came out of the RCX3 neighborhood assessments because our community prioritized walking and biking and wanted to see more walkable and bikeable neighborhoods. And so through the development of this plan, as we were engaging with some of our partners, ATP funding was brought to our attention. But we started to look into it and quickly dismissed it as something we really were not prepared to apply for as a department. We then approached our Public Works Department to explore the possibility of a joint application somewhere around 2018, 2017. And they really weren't very receptive. They sort of, they were going after ATP funding and thought, we're fine with the infrastructure alone and thanks, but no thanks. So what we did is we sort of didn't give up. We really spent about a year strengthening our relationship with our Public Works Department and really made them see the value of partnering with public health and including a non-infrastructure component into their application. And part of how we did that is already what's been mentioned as a strength we bring, which is, we offered data and we offered to assist with community engagement, which traditionally our public works departments don't do in the same way public health typically engages with community, to contribute to their Cycle 4 application. So when Cycle 5 came around, this was the first time that they said, hey, let's do this together. And so we did. This was actually in the middle of 2020, so you can imagine the chaos. But we submitted 4 applications, joint applications that had a non-infrastructure and an infrastructure component with our Public Works Department. They said they typically submit several with the hopes of getting at least one funded. And much to our surprise and much to their surprise, we actually were funded for 3 of the 4 applications. And in fact, they discovered that the applications that were submitted by the city were the highest scored applications of any that they had previously submitted, which really demonstrated again the value of including public health and non-infrastructure. So by Cycle 6, it was no longer a question by Public Works whether they would include us. They they reached out immediately and actually even involved us in the discussion around what infrastructure project neighborhood should be included based on data that we provide from public health. So it's been an interesting journey of some starts and stops. I did want to provide some tips. If you don't already know, if you're thinking like, hey, ATP might be great for us, we want to do something in the world of active transportation, I would say absolutely look into it. But I would encourage you to do a lot of sort of relationship building and maybe fact finding before you just pull down the application. So if you don't already know, start finding out if your jurisdiction already has previously applied, whether they were awarded or not, if they currently have ATP funding, or if there's a plan to go after cycle 6, which is the one coming up, or cycle 7, excuse me. And if you don't already have a relationship with that department, if you're not already linked in with them, then I would start by just reaching out and getting to know them. And not necessarily with the, hey, we'd like to talk about ATP, but just, you know, if you have a collaborative meeting, if you're doing things in the community, if they're hosting any community meetings, get to know each other. Build that relationship, because you really need to build what we like this catchphrase. We call it our coalition of the willing, and you need your ATP coalition of the willing, and Public Works probably has to be that group, or whoever in your jurisdiction is leading ATP, because you will need their partnership and possibly their buy-in. If they already have ATP and they've only submitted for infrastructure in the past, like us, you may have to sort of sell the value of non-infrastructure, but you may find that your jurisdiction has joint, but they're currently giving the money to another group, not even understanding or knowing that their own public health department can step up and provide this great non-infrastructure component to their project. And so I would encourage you to look at it in that way. The application can seem a bit daunting. Some of the language, as was mentioned, this is a transportation grant. And so it's not typical public health. There's differences in the time frame for allocating funds. You know, we're so used to a federal grant starts October 1 and work starts October 1, and we have learned the hard way that that's not how these necessarily work. So I would say take advantage of any and all technical assistance to prepare you to move forward. And that's why sometimes even just waiting a cycle and building that relationship, building that coalition, sitting in on some technical assistance might be the best way for you to go. So you know, in the interest of time, I'm going to sort of skip over some of the other tips, because I really want to share some of the types of projects that we've included in our ATP, to give you an idea of how this could potentially complement the work you're doing with CalFresh. For us, our ATP funding, it's a very distinct and separate program from our CalFresh. So ATP funds a program called Walk and Roll Long Beach. Our CalFresh Healthy Living is Healthy Active Long Beach. But though these are two separate programs, you'll see in the activities that they're really written to complement each other, and really allows for a more comprehensive and community-wide approach to achieving our CalFresh Healthy Living goals related to active transportation. So if you want to help me just quickly, we'll run through the slides with the photos. So again, I mentioned we had cycle 5 funding. There was 3 infrastructure projects that we included a non-infrastructure for, focused on walking and biking in key areas of Long Beach. Next slide. Can you advance to the next? Oh, there we go. Sorry, it's probably on my end. I'm going to turn off my camera now. One more slide back. I'm sorry, I think I jumped ahead. So some of the type of activities that we're doing with our Cycle 5 funding, we have been leading walk and bike audits, so community-led assessments of the neighborhood. We've been partnering to do pedestrian skill classes, and these are great. We can tack these onto a nutrition class by adding additional lessons and having the staff funded by ATP go out with our CalFresh Healthy Living funded nutrition staff to offer a wider selection of offerings for our community. We've been doing outdoor marketing like bus ads, which of course we can't do with this funding, and really leading awareness activities and awareness days. Next slide. And then I just wanted to share, I'm super excited for this one. This is our cycle 6, and this is really in the direction that I think ATP is heading, and it mirrors some of where we're heading. And that's really looking at equity and really looking at sustainability. And so less on one-time education and events, and we're really focused on train the trainer. We're going to be training community members to be licensed cycling instructors so that they can continue to educate their own neighbors and community peers and residents moving forward. And we're going to be launching things like a bike and pedestrian safety loan kit program so that organizations around the city can check out equipment and materials from us to host bike and pedestrian safety pop-ups throughout the city, long beyond when ATP ends. And I'm going to hand it back over.
All right, great. Thank you so much for that wonderful insight. So lastly, let's see, I'll run through these really quick. I'm just going to speak about the Active Transportation Resource Center, referred to as the ATRC for short. So that's really who I am here representing today. The ATRC is a program funded through the ATP and administered by Caltrans. We at CDPH have a working partnership with Caltrans to support the ATRC by providing statewide resources, training, and technical assistance to all current and potential ATP applications. We have a website where we upload resources and trainings that we provide, and everyone is welcome to visit the website. You can see I've added a snippet of the home page, but I want to highlight in the lower part of the page, the blue ribbon where it says join the ATRC mailing list. You can click sign me up. In there you can receive our quarterly newsletter and other important announcements that come out through our listserv. And let's see, the CDPH, so I also want to mention that at CDPH, we offer technical assistance through the ATRC. And so I have a wonderful team of 2 others. And so Victoria Custodios, she provides support for districts 1, 2, 3, 4, and 5. And then myself, I support districts 6, 9, 10, and 11. And then Marianne Hernandez, who you saw earlier today, who started the presentation, she supports districts 7, 8, and 12. And so lastly, in preparation for Cycle 7 Call for Projects happening next week, we at the ATRC are hosting office hours. These are open office hours, and you can drop in as you like if you happen to be one of the local health departments who is pursuing a Cycle 7 application. You can drop in tomorrow, March 15th at 9 to 10 in the morning, or at 1 to 2 p.m., or you can come to both. The links are provided there, and so we'd be happy to answer any questions you have. And with that, I will say thank you so much for allowing me to present on the ATP today. This presentation was just a very brief introduction to the ATP. There's so much more to it. And so my email address is there, as well as my other teammates. Please feel free to reach out to us if you're interested in exploring the potential of pursuing a future cycle application. Thank you so much.
Great. Thank you so much, Marianne, Alicia, and Laura, for presenting on the Active Transportation Grant and opportunities for our agency. So thank you. All right, we have just about we have 5 minutes